Ayushi.
Hi.
Hello. David Salt, one of the interviewers.
Nice to meet you.
How was your journey?
Not too bad, but a bit of traffic, but that's all.
Yeah, that's okay. I'd just like to start by asking you why you've chosen to apply to Manchester.
So, Manchester, in terms of the medical course, I think really suits me. I like thinking about problems, and the problem-based learning aspect of the course I think is really good in terms of getting you to think about what you're learning. It seems to give you a good framework for a certain disease and case, which is how you would be as a doctor. So I think it's a good way to start thinking about patients. And the group aspect makes sure you kind of cover everything and get a different perspective on the case. And the second thing, which I think is really important, is the patient contact you have quite early on. It's like from first year. So considering you're going to be a doctor and dealing with patients every day, I think it's the fact you're interacting with them from first year will probably make me a better doctor in the end. So I think it's really well suited to me.
That's really good to hear that. And I'd just also start by telling me something you've read recently.
So I've been, in terms of trying to prepare for being a junior doctor, reading Trust Me, I'm a Junior Doctor, which has had some quite amusing things, but also I think a good dose of reality in a sense for how busy it can be as a junior doctor in terms of on calls you have, the stresses you feel while working, which I think you don't have a good idea of, because such as when I went to work experience, I'm only there for the day. I see how it is when it's a full ward, where he's talking about how it is on night shifts and things where you're left to your own devices, which I think was a really good insight that I didn't have before.
And does that relate to anything that you've seen in your own work experience?
So I didn't see anything in my work experience that was that level in terms of stress, but I was speaking to a lot of junior doctors and they tell me about their own calls, and one in particular was talking about a sick patient they'd seen over the weekend where they felt quite worried for the patient. They were doing everything they could and were kind of asking for senior support, but there was another ill patient that they were with and they thought that they had to do a lot more than they would normally be expected to on a ward day. So they were again giving me a good idea in terms of the stresses, I think, of being a doctor, but also it was, at the end of it, they were quite proud of what they'd done, and I think that's a feeling I'm kind of looking forward to, being able to help someone by yourself, being proud of what you've achieved and genuinely making a difference directly to someone's life.
Thinking back to that time, what skills did they use to help them deal with that situation?
I think, so this particular doctor, he was a particularly calm sort of character, I seem to remember. He was fairly chilled, quite composed on the ward when everything was quite busy around him, which I think must have helped him in that situation. He was also quite well read. He kind of knew a lot of the science behind what he was talking about, when he'd always like go back to basics when he was trying to explain things to me, which I found helpful because I don't know much. But I think his innate character, knowing what he was talking about and being able to kind of ask for what help he needed, probably helped him a lot in that situation.
That's good. I'd just like to take you through a sort of situational type of question. So I'd just like to put yourself in the position of the person and think about, if this happened, what would you do in this circumstance? Okay. So the circumstance is you're a junior doctor, an F1 doctor, and you're on the ward round. The consultant comes in to do the ward round, to lead the ward round, and you notice a smell of alcohol that's come from him. Okay. What do you do?
So that's quite difficult, I think. So the implication is that he may have drunk alcohol and then come to the hospital to work. That's quite a serious kind of assumption to make. I think the first thing would be to make sure that it was a smell of alcohol that was coming from him and that it was due to consumption. The way to do that, I guess, would be to either voice concerns to my colleagues, see if that there was something that they agreed with, whether that was a concern they had as well. And I'm a junior and they're the consultant, I guess there's lots of people kind of between us in terms of the grades that I could go to for advice and voicing my concerns, just to make sure, one, hopefully that this isn't the case, but if it is, that it's not safe for patients, so it would need to be addressed. So just making sure somebody knew that would be able to do something.
What do you think the most important concern is in that circumstance?
I think it is the fact that patients could be affected by the fact that this consultant may not be in a state to treat them, possibly. So the patients would have to come first in that day. And I guess longer term is whether a consideration whether the doctor's fit to continue being a doctor or not.
And so having thought about it, what do you think is the best thing for you to do as a sort of step in that position of knowing that you have patient safety to consider, but you're in that position, what do you think is the best thing for you to do as a junior doctor?
I think it's to go to one of the seniors that I trust, voice my concerns, and perhaps say as soon as possible, ideally before the ward round, to make sure that the consultant doesn't carry on working that day, if that is the case.
Okay, that sounds sensible to me. Thank you. And I'd just like to go through a hypothetical situation as well, again, to sort of put yourself as though you're the person making a decision or thinking about this, and to see what your opinion of it is. And so the question is to say that if people are doing extreme sports or sports that have a very high risk of injury, should they be treated by the public health system or not? What do you think about that?
So I guess by doing extreme sports, they're high risk sports that have a higher risk of injury and therefore more likely to end up needing the public health system, which I guess there's an argument for saying it might be a sort of self-inflicted injury if they're taking the risk upon themselves. But I think that the public health system is there for patients and people to be able to live their lives, and if part of that living their lives is a choice to be able to do what they want, and if that is taking risks, doing things for sport or enjoyment, that should be allowed for, as long as it's not unreasonable in a sense. So doctors have a duty to ensure the health of the public. They have a duty to ensure promoting good health and to treat those who are injured and sick. So I think they should be treated, but perhaps with the caveat they're doing everything they can to make sure they don't get injured unnecessarily or irresponsibly.
So do you think there's a limit to what the public healthcare system should provide for?
In what sense? You mean?
In terms of, you think that in extreme sports, for example, as long as they take some sort of precaution, then even if they do something dangerous, that's fine, and if it causes an injury, then the public healthcare system provides for them. Do you think sort of extending that to any particular positions, surely the implication that if they take care, perhaps if they aren't taking any care at all, or they're being particularly reckless, how do you feel about that circumstance?
I think at least to the point of life-saving treatments that there shouldn't really be a question about it. I don't think we can deny people in kind of with good morals to deny them life-saving treatment. I think if it's a long-term burden on healthcare might be a problem. There might be certain sports where it should be advised or mandatory to take out personal insurance, where they can pay for things like rehabilitation. But I think at the point where there's a significant injury or risk to life, that it should be provided.
Okay. So, and just like to sort of thinking about the medical profession, lots of terms bandied about, and one of those is the GMC, the General Medical Council. What do you know about the role of the GMC and what they do?
So the GMC has the register of doctors, of those licensed to practice and allowed to practice. They maintain certain standards in terms of how safe doctors are, and they, I think when doctors' administered practice is called into question, they're the ones who kind of make a judgment on that.
Okay.
To decide whether or not they can continue to practice or not.
So what do you think the purpose of the GMC is?
To ensure doctors are safe practitioners and that patients are safe, essentially, for the doctors that are treating them.
Okay. And sort of thinking about the future, have you had any ideas about what you'd like to end up doing within medicine at all?
I haven't really thought about it all that much. I know at work experience I felt quite queasy in surgical theatre, so perhaps not that. But beyond that, no, I'm not really sure.
Okay. Still plenty of time to decide.
So I'm hoping.
Do you have any questions for me at all?
No, I think that's it.
Lovely. Well, thank you for coming today.
Thank you.
Ayushi, how do you feel that interview went?
I think it was okay. I think I kind of expected more questions about perhaps like why medicine and the classics, but the ethical situations were quite difficult, I thought, in terms of things I hadn't thought about.
Okay. And how did you feel you coped with those?
I think I tried to reason out a couple of sides of the argument to talk through, but I probably could have used some more solid principles and mentioned those.
Okay, yeah, I think that's a fair point. I think what you did well was not committing to anything at the start. You didn't dive in and say, this is what you must do, or this is what you shouldn't do, or yes, pay, no, don't pay, or whatever it happens to be. I like the way that you sort of took it steady. Talking about the extreme sports, for example, you sort of thought through a few different things. You thought through the arguments behind it and the duty of care of the healthcare system. But I agree with you. I think by sort of verbalising, the sort of pillars of medical ethics and thinking about it that way, you could just add a little bit more structure to the answer as well. And likewise with the sort of response to with the drunk consultant or potentially drunk consultant, I think that's very good as well. I think it's important to, as you did, gather information first of all and not dive in with anything. You identify the most important thing, which is patient safety, which always that comes above causing somebody embarrassment or whatever it might happen to be. And it's just finding a pragmatic way to sort of raise that. And I think going through scene is a very sensible approach. So I thought you approached the sort of consultant smelling of alcohol question very well. I think the ethics of the extreme sport thing, I think just a little bit more structure could have led to more clarity with that and really elevated that to being a top-notch answer. Then finally, just one thing I would also add is I was a very nice interviewer in that interview. A few times I didn't quite finish off an answer and I sort of said, well, what do you think of that? Or and sort of led it in that direction. Some interviewers will do that to help you, but some interviewers won't necessarily do it. So try to finish off your answers always, when you've done the sort of talking bit and the describing bit, always try to finish off your answer by saying your personal opinion of it, what you think, or really bringing it to a good conclusion that makes it really clear. That way, even if the interviewer chooses to move on, you've made your point and you've really shown that you actually, yes, you can think about this, you have thought about it, and this is your answer. So I think that's a good thing to do as well. But overall, it's a good interview, so well done.